26 million Americans, that's 1 in 9 adults, have kidney disease, and 90% don't even know it. It is responsible for more deaths each year than breast cancer or prostate cancer. We not giving up, we gon' win. We are warriors, champions. We not giving up, we gon' win. We are warriors, champions. 1 in 9, 1 in 9, do you know, do you know? 1 in 9, 1 in 9, do you know, do you know?
Welcome to the 1 in 9 Tribe podcast, the show that brings awareness, solutions, and hope to people who want to be empowered with their health. I'm Annalyn Scott. With me is my husband, Raymond. And today's discussion will focus on cardio renal metabolic disease prevention. I know that's a mouthful. And here with us is our special guest, Dr. Kris Vijay, who is a non-invasive cardiologist and trained endocrinologist, clinical lipidologist, an ardent researcher, and a heart failure specialist. He is a clinical professor of medicine at University of Arizona, past governor of the American College of Cardiology, immediate past medical director of the Institute of Congestive Heart Failure at Abrazo Arizona Heart Hospital and Abrazo Health Network in Arizona, a founding member and past president of the Cardio Renal Society of America, current president of the TwinEpidemic Inc., a nonprofit organization addressing diabetes and heart disease among underserved communities all over the world. And we're very fortunate to also have him on our 1 in 9 advisory board. Thanks for joining us, Dr. Vijay.
Thank you so much, Annalyn. It's such an honor and a privilege to be here.
Well, and again, with that bio right there, and I had to condense it. I couldn't think of a better person to be here for this discussion. You know, as we talk about the, not only the connection of, what are the connections between heart and kidneys, but even going beyond that, and CRM, or cardio renal metabolic disease. Can you help our audience understand a little bit more of what that is and how heart disease, kidney disease, and diabetes are really considered a triple threat?
Yeah, absolutely, Annalyn. That CRM is going to be the buzzword. That's now hitting headlines everywhere, primarily because we are now realizing that there are new medications in this interconnected space. So that's actually impacting and preventing progression of kidney disease, worsening diabetes, and the complications thereof, and preventing heart attacks, strokes, death from heart disease, and preventing heart failure. So it's kind of doing something magical, so to speak. So because of that therapeutic advance, the theme of the cardio-renal metabolic intersection is becoming very popular and becoming very apropos to the discussion that is happening in multiple different subspecialties in the United States and across the world. The connectivity, Annalyn, is because of the risk factors that actually binds all these three diseases together. So what is heart disease? Well, heart attack is blocked artery. Heart failure is weakness of the pump or not relaxing properly. And then you have valve disease, and then you have rhythm disease of the heart. What is kidney disease? You have, protein spilling in the urine, and slowly the kidney function really gets worse. And then slowly dialysis happens because of end-stage renal disease, which is where you don't want to go. And then what is diabetes? Is blood sugar, but pre-diabetes is before the onset of high A1C level, as we call it. Mm-hmm. But that population also is at risk for heart disease and for kidney disease, even though they are pre-diabetic. Mm-hmm. Like even Raymond probably was pre-diabetic for a while before he developed kidney disease, and unbeknownst to you, it's creeped up on you. Mm-hmm. And then you became overt diabetic after you had your kidney transplant. But then that pre-diabetic space, did you know, can encompass for almost 10 to 15 years before you actually develop diabetes.
Wow.
And during this time, you're at risk for heart attack and heart failure, and you're at risk for kidney disease and worsening kidney failure and dialysis.
Wow.
So that space is so important now. And all the three different diseases, as you asked me, what is that link? that link is again the risk factors, and that risk factor is diabetes, blood pressure, obesity, lack of exercise, abnormal eating habits, nutrition, and then that inner lining of that blood vessel that we talk about, which connects head to the toe, every organ in the body. And that inner lining, we call it endothelium, the glycocalyx intersection. And that intersection is very important when a risk factor is present in a patient. Suddenly, that inner lining becomes dysfunctional, and that leads to all kinds of complications in disease processes. So stabilizing that inner lining should be the name of the game.
Yeah. In fact, that's something we're going to be even exploring going deeper to the root at that microvascular level in a future episode, because it is so key. It does cross, like you're saying, really all of those disorders. And the other thing that I'd like to point out is how silent all of those disorders can be. Like you just said, pre-diabetes, most people may have that for about 10 years. And oftentimes not really, they probably feel okay and aren't recognizing that they're having problems with their blood sugar and maybe other conditions going on inside that they can't see.
So true, Annalyn. Did you know that there are about 600,000 adults living with diabetes in Arizona alone? Mm-hmm. And did you know that about 2 million adults have pre-diabetes? We talk about 600,000 with diabetes, but there are 2 million people out there who don't even know that they have diabetes, they're pre-diabetic, and they are at risk of kidney disease and heart attacks and stroke. And the number is increasing dangerously. Close to 90% of those with pre-diabetes are not aware of it. And the current population growth trend by 2050 in Arizona is going to be 12 million people with diabetes. And you know how much
Arizona alone.
And you know how much we are spending on diabetes? A staggering $6.8 billion with a B every year, only for diabetes care.
Unbelievable. Something has to change. It's not going in the right direction at all.
Exactly.
It's
going the opposite direction. And we're not doing anything about it. I mean, the state has a mandate. They put together, in January 2021, what do we do for diabetes? A full program of, prevention of complications of diabetes in all communities in Arizona. But I still think that more needs to be done. Mm-hmm. And I think the awareness, education, the empowerment of the community, we need to be doing much more aggressively and actively in moving forward. Mm-hmm. I think we have a lot of things that we need to, miles to go before we sleep, Annalyn.
I agree. And, I think even Raymond can chime in on this too, because he was part of that 90% of people with kidney disease that don't know that they have it. He knew that he had high blood pressure, but wasn't checking that regularly. Didn't understand how everything was interconnected. And unfortunately, we had to learn, I say we, because we went through this together. He experienced it, but we had to go through encountering heart disease, encountering diabetes, all of the, this domino effect through his health. That's how we discovered how interconnected it was.
Yeah, because we talk about the risk factors of African American, check 1. High blood pressure, check 2. There's those risk factors that just getting out of the military, I didn't concern myself with. I'm 10 feet tall and bulletproof. I'm good. No.
And you were young too.
Right.
You were only 29 when your kidneys failed.
Yeah.
So most people are picturing, first of all, most people don't even know what kidney disease is, or they may equate it to, kidney failure or dialysis. And here, Raymond didn't know that he had kidney disease probably for several years before his kidneys failed. And even from that, we've experienced, due to the prolonged high blood pressure, I mean, Raymond has had to go through open heart surgery. So he does, first of all, Raymond doesn't do things small.
Yeah.
So let's be clear about that.
Everything.
Yeah, it doesn't do anything small.
Larger than life.
But
Yes. Yes.
So kidney failure at 29, open heart surgery at 39
Oh my goodness.
for a dissecting aorta
Oh my
due
goodness.
to prolonged high blood pressure. 6 months after his kidney transplant in 2001, wasn't feeling very good. Went to the doctor, went to work actually.
Yep.
No, I take it back. He did. He went in to do his blood work. He went in to do his normal blood work on his way to work and came home. He gets to work and they're like, "You look like crap. You need to go home." And he's
Yeah.
thinking maybe it's the flu. So he's drinking Gatorade. We get a call the next morning from his transplant team, that team kind of monitoring his kidney after transplant, and they said, get him to the emergency room immediately.
Oh
His
my goodness.
blood sugar was 1,000.
Oh my goodness.
And I was just walking around nothing.
Yeah.
That man,
I just felt
feeling
tired.
Yeah.
You know, but that was the only thing. Like, okay, maybe I'm coming down with a cold or something.
Yeah.
And why do I look so bad?
Interesting, right? So we hear it. We hear you. I mean, everyone out there should be hearing this, and knowing that, kidney disease is highly prevalent. Did you know that for some numbers, 37 million people in America alone have kidney disease, and guess what? According to the CDC, 9 out of 10 people with early kidney disease don't even know it.
Mm-hmm.
And of course, kidney disease, what people don't know is that you don't die of kidney disease. You land up with end stage, and then you land up on dialysis, or you get a kidney transplant. But then the risk factors that led to kidney disease, such as diabetes or high blood pressure or unhealthy eating habits or even smoking, actually they're all the same risk factors that causes heart attacks and strokes. Mm-hmm. So kidney disease in turn can actually lead to heart attack and strokes. And people don't know that. Wow. And I think that's another message we need to impart, that kidney disease does not live in a silo. It actually affects retrograde fashion, affects the heart. So the 5 types of the heart-kidney intersection that they call it, cardio-renal syndrome, acute or chronic heart disease can lead to kidney disease, and acute or chronic kidney disease can lead to heart disease. And then the 5th one is a systemic disease like arthritis, rheumatoid, lupus, and so many, which affect so many other systems in the body, can affect both the heart and the kidney. That's your 5th type of the cardio-renal interconnectivity, or syndrome as we call it. But it's very, very obvious that as you already talked about, Raymond, about being black and being Hispanic and having diabetes and having high blood pressure. And what's interesting is that there are 550,000 patients today who are on dialysis, and nearly 230,000 people are living with kidney transplant. Every month, almost 11,000 new kidney failure is being diagnosed.
Wow.
And did you know that the end-stage kidney disease beneficiaries, according to Medicare, they spend close to $50 billion through dialysis. And it's only really 1% of the total Medicare population. But a patient on hemodialysis for Medicare, it costs close to $93,000 per year.
Wow.
My goodness.
And for each kidney disease patient who does not land up with end-stage kidney disease on dialysis that you prevent, Medicare says $250,000.
Wow.
These are all numbers I'm throwing out there for the audience,
Yeah.
because these numbers are staggering, and they should know the statistics out there.
They should, because with everything we're doing with our efforts with 1 in 9, and I know you're seeing it too with TwinEpidemic, we're seeing more and more people that are having, crashing into dialysis like Raymond did, and, that are having, a lot of these other issues. But they're shocked, they're upset, they're saying, what just happened? I didn't even know there was a problem with my kidneys. And Raymond being on home hemodialysis, it's given him a lot more freedom. He's feeling a lot better. In fact, we just got finished with treatment less than an hour before coming here to record the show today.
Oh my goodness.
And look how
Look at
handsome
you.
I look.
You look great.
And modest,
Look
and
at
modest.
you. Look at you. Nobody would have thought he just went through dialysis and you're coming here to give a podcast. I mean, I can't believe that. See, that's the beauty. You are so energized about living and
Right.
about making an impact on not just your life, but on everyone else around you.
Yes.
I think that's what I believe is making you feel good and living longer. And something about you, your persona, your inner strength given by Annalyn and many other people close to you, that inner strength that you're absorbing from everyone around you is what keeps you going.
Yeah.
And that's something, I don't know how to quantify and measure that. We're working on it. But that inner strength is what you got. And that is the message we need to impart to the audience. Hey, get your inner strength to the sticking point, will you?
Yeah.
Then you will feel good. Then you will live longer. How do we do that?
Yeah. Well, I find strength in, of course, my faith and this wonderful woman here who's my bulldog.
Yeah.
And it's that fire. It's, if she is going to invest so much, she and my kids, that is, invest so much into me, okay, what am I giving them in return? So that's where the discipline comes in. And that's where, okay, 4 or 5 days of the week, I'm exercising. I got to push myself. I got to be different. I cannot be normal or wait around for things to happen. I got to make things happen. And that's also that discipline that comes from being in the military too. But they have invested a lot into me. So I have to return that back to them. And that's how I do it.
That's so beautiful because just you being around gives them that strength.
Mm-hmm.
Yes.
100%. 100%. And I see Raymond also turn around and pay it forward to others. So, obviously with our efforts, we want to get that message out there so people can avoid a journey like Raymond's. But he's talking to patients every day that have started dialysis, and he's talking to them about even the benefits of home dialysis, how that's helped his heart, how that's helped give him more zest and zeal in life, be able to work out 4 to 5 days a week. And I just even see when he comes off some of those calls with some of these patients, like this new energy in him. Mm-hmm. It's a blessing to be able to do that.
Yeah, it's like you're changing people's lives. That's how I feel. Instead of it being dark, they can, okay, this guy has been living with it for 23 years. Yeah. Okay, can I make that?
Yeah.
I think I can make that.
Yeah.
So, if not more,
Yeah.
So it gives them a drive too to see that, just because you're a dialysis is not a death sentence.
No.
And that's what we live by. And that's what we had to live by. Especially with, and I'll just be honest with you, I never heard of the term cardio renal metabolic disease, and I am under that umbrella too, to be honest with you.
Mm-hmm.
No, you're so right. I think, truly we're all blessed. And beyond that, I think, you are a role model for so many out there. And there are so many patients are all struggling, and subjects who are struggling with diabetes, blood pressure, and the fear that they're living with, that they might land up with a heart disease or a stroke or kidney failure.
Right.
And here the message is very obvious just by you being here and advocating that message that, hey, it's not too bad if you get there, but your message on a constant basis is that, hey, let's prevent you from even getting there to the point where I've gotten. And I've struggled my way, but I'm blessed and I'm humbled and honored by all the support I've received. But you know what? I don't even want you to get to the spot that I went 23 years ago.
Yes.
I don't want you to even get there.
Yes.
That's our message constantly, that we're working on preventing that onset of heart disease, that onset of kidney disease, that even onset of blatant diabetes or its complications with eye disease or blocked arteries in the legs or neuropathy with pain in the legs and the hands, and then the kidney disease that we struggle with, right? And so, yeah, it's got to be about that prevention.
It has to be. And I think prevention and also empowering people to know that they can reverse some of these conditions. They can improve some of these conditions. You know, Raymond taking that active role of saying, okay, what can I do? He's been on home dialysis for the past 9 years. So that with that extra level of energy that he's had, okay, I can work out more often. Now I'm feeling even better. I can do more. We started seeing some of his medications drop off. As we share in our film that, by the way, little plug that you're in as well, with A Dance with Destiny, you know, we were able to show just key things that he was able to take charge of his health. Even at the microvascular level, you know, a nutraceutical that was able to help him as well. So all of these factors kind of coming in where he says, there are things I can do. I am empowered to do for myself to be able to bring his high blood pressure, have it be more regulated and see those medications drop off, to see, you talk about even the narrowing of the arteries, stenosis and narrowing of a main artery that would prevent him from being able to get a kidney transplant is now free and clear. Allowing him to get on the kidney transplant list, to see him being able to reverse his diabetes after being a type 2 diabetic who was on insulin for 14 years.
Oh my goodness.
To no longer be on insulin, to no longer be on any diabetic medication for the last 5.5 years.
Yeah, wow.
And averaging an A1C of like 5.4, 5.6,
That
maybe a
is
little
phenomenal.
after Christmas or Thanksgiving, maybe a little bit higher. But honestly, you know, he's averaging about 5.6 on his A1C. And so I think a lot of people think, oh, this just runs in my family. Or once I have this, there's no going back. It's too late. There's nothing that can be done. And I think we want to challenge that paradigm and say, no, there are things that can be done. Raymond's a living example. And there's others too. He's not alone. But what do you see, Dr. Vijay, as being things that we can do from a prevention standpoint to avoid CRM and you know, these disorders that we're talking about today?
No, so apropos, in terms of the segue to our next discussion point, which is about prevention and intervention. So if you look at the spectrum of healthcare, we are in this spectrum of where there is prevention. Right in the middle is a lot of the intervention, and then on the other side of the spectrum is end-stage disease. And this could be for heart disease, it could be for diabetes, it could be for kidney disease. The end stage here is heart failure, transplant, which has been my advanced heart failure, has been my subspecialty, what is called LVAD, assist devices. Those are all happening in that space at end-stage heart failure. Or they go to palliative care, hospice, and things like that if they don't qualify. And then the end-stage kidney disease is, again, dialysis or transplant. And then end-stage diabetes is because of the complications thereof, with blindness, with severe neuropathy or amputation of both legs. The quality of life really, is in their boots. And they're not able to perform or function, actively. They can't see, they don't taste well, they can't swallow food. It affects the GI tract, affects the liver, affects every part of the body from head to the toe. They could have had a stroke, they could have had a heart attack. So, and then the interesting thing, again, the statistical point is that heart attack in a diabetic happens, heart attack in the kidney patient happens. And did you know that every 36 seconds, somebody's having a heart attack in this country?
Wow.
By the time we are done with this podcast, did you know there are already 3 or 4 people who have had a heart attack? Every 40 seconds, somebody's having a stroke. Every 40 seconds.
Wow.
So many would have, 36 seconds we're talking about. So we're talking about 30, 40 people right here, within an hour, right?
Right.
So now the bottom line has to be about prevention. So what do we do in America? in the U.S., we are just going in the wrong direction. I'm sorry. I'm going to make a big point right now. And this is for everybody out there to hear, to listen up, including payers, insurance, Medicare, high large systems. And the point I want to make that we are so reactive in the United States that we pay big chunk of money, we spend big chunk of money, the country does, for a reactive process or processes such as putting in stents, putting in valves, new valves, putting in new devices, putting in pacemakers, putting them new heart, giving them LVAD, big ticket items, or putting them on dialysis, big ticket item. We just talked about how much it costs. So we put so much money in that reactive space. And what we are doing is harm, because we are now forgotten that we ought to be putting a large chunk of money. The country, the system has to put money in the prevention space at the beginning of the spectrum, as we call it, where we should not even allow those patients to become diabetic or hypertensive or have kidney or disease or strokes. We should not even allow them to get there. We are to be preventing, that's called secondary, primary and secondary prevention. But primordial prevention is preventing onset of high blood pressure, preventing onset of diabetes. Now that you don't have diabetes, can we make sure that you don't get an A1C higher? You may get a kidney transplant, Raymond, fairly soon, and then some of the medications may put you at risk for high blood pressure and diabetes. And yet, if we prevent the blood pressure from going too high and crazy and causing more problem, or prevent A1C from going too high and causing complications from blood sugar level, we have medications, we have lifestyle modifications that we can do in this space, in the prevention space. But we had to put big chunk of money into prevention centers of excellence. And that's what the country needs to do. We have new medications available out there that will prevent complications in the CRM, the Cardio Renal Metabolic space. And we have new therapies that's available out there. 2 groups of drugs are hitting headlines as we speak. So yeah, there is hope, and there is dream, and but we have to act now. And we have to act, the country has to act on putting incentives and big chunk of money and putting a lot of effort and energy and enthusiasm and money into prevention and education and knowledge and awareness and lifestyle modification. We can do it.
Yes, we can. Yes, we can. And I'm definitely one that always sees a glass as half full, not half empty. And this is a huge challenge to take on. But even when we got started with 1 in 9, that was our goal, was to really change the trajectory of kidney disease and save millions of lives. In order to do that, we have to change the trajectory of heart disease and high blood pressure and diabetes. And you know, if ever there was a time to ring an alarm, it's now. I mean, it's past now, right? I mean, this has been going in the wrong direction for years now, but it's not too late.
Yes.
And so we thank you for being here with us to sound this alarm.
Yes.
To help bring the audience into the know, you know, to challenge, you know, the paradigms that they may have, to encourage and empower them that the next time they go in for their annual checkup or, you know, a visit with their endocrinologist or nephrologist or primary care physician, that they're armed with more information. They can go in with more questions. And I think also I'm going to challenge, like you were earlier, the healthcare system and the professionals that are out there. It is time. It's been too siloed. It's time to kind of look at the whole person.
Yes.
And address the whole person. And so I'm encouraged. I'm excited. Dr. Vijay, thank you so much for joining us today. And for those of you who have been enlightened, have been encouraged by this, we ask that you just go on our YouTube page, like and follow us. Share this with other people that you think may benefit as well. And make sure and stay tuned for the next exciting, encouraging, empowering discussion that we're going to have here with 1 in 9 Tribe podcast. Thank you. God bless.
God bless.
1 in 9, 1 in 9. Do you know? 1 in 9, 1 in 9.